I haven't had a mammogram yet, but while I like to think I'm pretty good at managing my healthcare and doing things I don't like to do, the idea of getting a mammogram does make me a little nervous. So today we are going to talk about what to expect when you get a mammogram, and here's some real life info and tips from women who do thousands each year. With over 50 years of experience combined, we are happy to have Dottie Hunter, section leader of mammography, and Janet Oyer, a registered mammography technologist at Emerson Hospital's Hermel Breast Health Centers, join us today for this important conversation. This is HealthWorks Here. I'm your host, Caitlin White. All right, ladies, so tell me why mammograms are so important.
Well, routine mammography can detect early cancers early on when they're smaller, easier to treat, and certainly saves lives sooner. So they're very important to do routinely.
And when should I get one?
The American College of Radiology suggests a baseline mammogram for women by age 40. So we follow that guideline, and we do suggest a mammogram every year after that.
So, like I said, I'm 30. I still have a little time, and right now it's all a little intimidating to me. I mean, for someone like me who hasn't had one yet, what is the machine like? Does it make a lot of noise? Is it big?
Well, the machine itself it's freestanding. It's fairly large, but what it does have some soft noises to it or soft sounds to it as it moves through the exam process. And pretty much the technologist explains the machine to the patient, too.
Now, who does the mammogram, and how do they become qualified to do that stuff?
Well, our mammography technologists are registered through the American Registry of Radiologic Technologists, so that's an organization that we generally belong to, and the FDA and the Department of Public Health also have guidelines that technologists have to meet before they are allowed to do this specialty. It is a specialty, and they become a radiologic technologist and certifying that before they can become qualified to do a specialty such as mammography.
So the whole process, by the time I get there, how long will it take?
Well, our appointments are scheduled 15 to 30 minutes. Now, it depends on what kind of test the patient's having. A screening mammogram is shorter than diagnostic, but when you're actually imaging the patient, it's much shorter. Each individual image could take anywhere from 8 to 12 seconds. So a patient is not under compression that long, but compression is part of the exam. But it will depend. It will depend on what the patient needs as far as how many pictures and what we're doing for them that day.
Now, here's the big question. Does it hurt?
Well, every patient has a different threshold of discomfort. And so while under compression, so the discomfort actually subsides quickly as the compression paddle is released from the breast.
Now, what if it does hurt? Does that mean something's wrong?
Well, the patient needs to communicate to the technologist if it's really giving the patient a lot of discomfort, so that the technologist can adjust either the compression or the position. So it's a level of communication between the patient and the technologist.
So whether it's my first or my fifth, is there anything I can do to prepare myself before getting a mammogram?
Some patients like to take either a Tylenol or an Advil about 1 hour before their exam, but certainly check with their doctor before taking any medication.
Now, what are your best tips for easing the anxiety of getting a mammo?
The patient should talk to the technologist in terms of any of the concerns that they might have. So they work as a team. So that's a good level of communication. If the patient can talk to the technologist, then they work as a team, and the outcome is more of a positive patient experience.
Now, I don't do breast self-exams often, and I'm nervous about getting a mammogram. What should I expect?
You shouldn't be nervous at all. Don't hesitate to have your mammogram. It's part of your breast health care. Your referring physician can perform a breast exam, during your yearly checkup. Breast self-exam is recommended to do 7 to 10 days after the start day of the period. That can be very difficult for some women to keep up with, and some people aren't having periods anymore. So we suggest a same time, same date every month. So rather like the 1st or the 15th, so that, there's some kind of routine.
So once the procedure's over, when do I get my results? And what if I want them sooner than that?
Well, patients standardly receive the results 7 to 10 business days. If you're nervous or you live, far away, or there's health concerns, just physical difficulties, just kind of getting in and out of the clinic, you can have your mammogram run the same day. It's just a matter of communicating that when you come into the clinic and letting the technologist know those concerns, and we have the radiologist read it while you're here. Patients having their screening mammogram can read the same day, and in a matter of time, if the radiologist is busy with diagnostic patients, they may have to wait, possibly up to an hour or a little longer, but we will try to read it as soon as possible so they have that information before they leave.
So, of course, waiting for that call, we always hope it's a good bill of health. But what happens when that call comes and the results aren't so good?
Well, screening mammograms do occasionally come back abnormal. That's not unusual. If we get a phone call from a breast imaging center, if you get it from us, then don't be afraid. That's not abnormal at all. We are investigating a specific area of question, and we need more information, which means different types of pictures and different positions. That will be determined by the radiologist, and they'll read that mammogram when you come back, same day, so you'll have an opportunity to ask more questions, even speak to the physicians if you would like. Sometimes it can be due to an artifact, simple as deodorant, jewelry, or even some of your hair that got into the image. So we're always really careful to check that while the technologist is imaging, but it can still happen. So occasionally it's a technical difficulty, not even a problem within the breast.
So what is your approach like with women when they come in for a mammogram?
When a patient comes in for a mammogram, typically it's common for them to be a little bit anxious and nervous. So we try to relieve some of that anxiety to make sure the patient feels that this is a safe place to share your concerns and to let the technologist know any concerns that they might have so we could relay that to the radiologist. So we're very compassionate and empathetic caregivers, and we try to be warm and as friendly as possible. And we try to work with the patient in terms of any issues that they might have in terms of breast shapes and sizes. And sometimes patients have had prior surgeries, like a pacemaker insertion or breast reconstruction or implants. So we try to work with the patient and explain to the patient exactly what we're doing so they're very more knowledgeable and they become more of the team. And so it just makes for a better positive experience if the patient feels comfortable to have that communication. And so and our staff, we're trained to know how to work any challenges.
And, of course, when it comes to healthcare, I have to ask about cost. How much do mammograms cost?
There's a couple of different types of mammograms we do. We do an annual screening, which is covered generally by insurance for asymptomatic women. The diagnostic mammogram is generally a follow-up done to something found on a mammogram or a patient that might have a lump, a blade discharge, focal pain, skin thickening. Those are things that they find themselves or their physician finds that send them in, and that requires more workup. That requires a physician appointment, basically, with our radiologist that will read the study at the time and do any additional imaging, possibly even a breast ultrasound if needed. So those are things that are concerning for patients. What is that cost? We do suggest that the patient having a diagnostic mammogram check their insurance coverage for any unexpected out-of-pocket expenses that might happen that they weren't aware of. So we want them to do that prior to coming in. The screening mammograms are generally covered by all insurance.
This has been a super informative conversation. I know I've learned a lot as a woman myself, but what if listeners have even more questions?
Well, we're here to answer questions. Before, during, after your appointment, you can always call the Breast Health Center, and we're happy to direct the questions to the appropriate person. We have a patient clinical navigator that's specifically set up to help navigate through our, outside physicians all the way to our breast surgeons and oncology. So we're here to answer your questions. The Hermel Breast Health Center can be reached at 978-287-8100. So if there's any questions or concerns, there's healthcare professionals here that are well-rounded, informative, and happy to answer any questions, and we do that every day. It's part of our normal practice.
Thank you so much for your time, ladies. It's always good to have this information ahead of any procedure. That was Dottie Hunter, Section Leader of Mammography, and Janet Oyer, a Registered Mammography Technologist at Emerson Hospital's Hermel Breast Centers. For more information or to make an appointment for a mammogram, go to emersonhospital.org and search mammogram. Thank you for listening to the HealthWorks Here podcast. Subscribe to this podcast on your favorite podcast source, including Apple Podcasts, Google Play Music, and Spotify. I'm your host, Caitlin White. We'll catch you next time.